that is that kind of bit of scientific truth that people have built on to say, okay, maybe fecal transplants can be a potential treatment.
Dr. Penner, so nice to have you on the program today.
Thank you so much for having me.
Dr. Penner, you are working frontline with families of children with autism. How often do wild treatments, come up in conversation?
If I have a full day of clinic, there is an unproven treatment that is going to come up in discussion somewhere. So, often families are encountering these things in their parent groups, online, in different autism groups that they might be in. And I will say that it's a good news thing for me when families actually bring that question to me as their physician, and they want to know, is this a thing to give my child? So I think that's far better than the alternative of a family just kind of deciding to try it out without informing their healthcare provider.
Doctor, we're seeing everything from drinking or bathing in urine for supposed cures to fecal transplants. I mean, is there any truth in any of that?
Right now, we don't have any evidence that there is anything that you can put in your body, put on your body that addresses the core features of autism, and certainly not that would be a cure for autism.
And then I think about the fecal transplants. I mean, are there like grains of truth sometimes that people latch onto?
So in that case, right, we do have evidence that autistic children have different microbiomes or the gut bacteria, that live inside your body, and that could be due to the different diets that they eat, and that is that kind of bit of scientific truth that people have built on to say, okay, maybe fecal transplants can be a potential treatment. What's important to know with that is that even though there's a bit of scientific truth there, it has not followed the full scientific process all the way through to be able to say we know that a fecal transplant is a safe and effective treatment. Far, far from that. So fecal transplants are not something that I am recommending for any of my families.
What sort of health risks are you worried about when it comes to unproven treatments?
There are myriad health risks that can come. They are all sort of dependent on what the particular treatment is, as well as the route that the treatment goes into your body, right? So, exposing your skin to something like a bath can cause skin irritation. There are other routes, though, that can be even more dangerous. So putting something inside of your body carries more risk. And then we have also heard of IV-based treatments, and those certainly carry the most risk that go along with them. And so one of the ones that we always recommend against IV chelation, which was due to the kind of debunked idea that autism is related to metals in your body that can cause rapid shifts in the minerals of your body, and has a mortality risk that is associated with it. So children have died from that treatment.
It's so crazy because we know that so many parents are just trying to do the best for their kids, and then you're just seeing such harmful effects of just trying, right, and seeing what's out there. It's so scary to be thinking about.
Absolutely. And that's why it's so important to understand where that family is coming from their emotional kind of landscape, and meeting them where they are at that way, but also trying to kind of redirect to safer and more effective alternatives.
So then what does a proper treatment and support plan look like?
Yeah. So really, we start with hearing the family's lived reality, that child's lived reality. What is causing the most friction in their day to day life? And often it is not about kind of finding a cure for autism. It is about finding a way to help that child build specific skills that they need. So they may need skills with communication. They may need skills with some of their, daily living activities like getting dressed or going to the bathroom. Those things can have tremendous impact on a child's quality of life. And so what we do is try to think about the therapies that can help those children learn those skills.
What's one piece of advice, doctor, you have for parents navigating this murky information environment?
Go talk to your doctor, please. These studies are often really, really hard to unpack, to understand where the quality elements of the studies are. Your doctor has had training to be able to do that. And so, instead of doing your own research online, where you might find some studies, um, just the existence of a study is not enough. You really need to talk to your doctor to be able to understand how well has this been studied? Do we know that it's effective and know that it's safe before I give it to my child?